Hi there, this is Ben with HCL Thrive, and today we're going to talk about our home health agency geographic data. The general idea is that one can get a better idea of a provider's local environment from this data, and it'll be helpful for marketing and or strategic planning purposes. The data sets I'm going to discuss include our utilization projections, specifically home health agency projected visit within FIPS or county codes. Then I'll discuss our GeoID data set, which includes core identifying variables. This includes latitude, longitude, address, provider details, as well as website if it is available. Finally, I'll talk briefly about the provider of service data set. This just gives more details about the provider characteristics itself, specifically information about when it was licensed and then how many different types of employees it may have, how many RNs, how many home health aides, etc. So to give you a brief overview of our home health agency visits projections, for home health agencies, we model agency, independent, and then informal visits as well as aggregates. Projections go up to 2160, and these utilization projections were developed using population projections and health and demographic data to model home health visits. This is just going to be a brief overview of the methodology. We have another video entirely devoted to methodology if you're interested. But the long and short of it is, the model was developed using the MEPS data set, Medical Expenditures Panel Survey. So the model was developed using demographic variables as well as health conditions. The outcome variable, of course, was home health visits utilization. We used negative binomial regressions for the predictions. After the model was developed, we then predicted utilization using BRFSS and POMS. POMS is from the American Community Survey, whereas BRFSS, Behavioral Risk Factor Surveillance System, is from the CDC, which is quite a mouthful. So anyways, home health utilization was modeled and then estimated using these two data sets based on the fact that they also have demographic conditions, at least for ACS, and then the BRFSS also has health conditions. And the advantage of these is that they're done at the geographic level. POMS is the public use microdata area, which is at least 100,000 people, whereas BRFSS is done by state. Contrast that with MEPS, which is only done by geographic region. Then after utilization was estimated, we aggregated up the probabilities by macro geographic area and then multiplied that with population projections. And this resulted in a couple data sets. One was aggregate, so utilization across all demographics, and another one is done by age, sex, and race. So here, under the Home Health Agency Geographic Data section, you can see a brief description here. And then if you want the full technical documentation, you can get it right here. In terms of data tables, given that it's age, sex, race, and the projections go quite a ways into the future, it's really too large to do the broken down data set. However, we do provide the aggregate, which is a lot smaller. And now looking at the data table, you can see it's done by year, FIPS code, measure ID. Now we get to our GeoID and provider of service data sets. I don't really have a whole lot to add from my overview at the beginning, so let's just jump right into the data tables and take a look. So let's start with the provider of service data set. So as you can see, geographic information, CCN, the merged to other data sets, we have measure ID and value. And here you can see some of the variable definitions, branch count, employee number, home health aid number. So basically, like I was saying, a bunch of organizational identifying characteristics. And finally, coming to the GeoID data set. So as you can see, some of the variables, facility name, street address, this is taken directly from the provider of service. But then we added some other variables, most notably URL if it's available, and then latitude, longitude. So hopefully that's useful. Anyways, that's about it. If you have any questions, please let us know, and thank you for watching.